Oh, hello, hello. Good evening.
Good evening, Professor.
How are you doing?
I'm fine. How are you?
I'm doing fine, thank you.
That's good. That's good.
Yeah, today is Thursday. Monday is a holiday, so we won't have a class on Monday, this coming Monday. So,
Hi,
oh,
Professor.
how are you doing, Kiana?
I'm good. How are you?
Good, good. Haven't seen you for a while, huh?
Yeah, I started volunteering at a clinic.
Oh, do you?
Yeah, they
Uh,
teaching me how to to do the blood draw and everything. I've been doing it on patients here and there.
That is wonderful. I'm
Yeah.
glad to hear that. Yeah, yeah, you're preparing yourself. You're really doing it.
Yes, I'm gonna put on my resume.
Oh, that of course. That's gonna be very good. How Idris, how you doing?
Where is it? Yeah, I'm fine. I have a question. Did you
Sure.
send out? I didn't receive the grades for the finals from the last test that was given exam. And did you
Well,
send out for the following one? I know you said yesterday you were going to be. I'm not sure if you posted it already.
um, are you talking about the last module? The office, the medical office procedures, grades?
The finals that we
Yeah,
had.
yeah, yeah. The grades for the finals. I already sent it. I already.
I didn't get mine. I didn't receive it. I just receive an email saying that you receive it, but I didn't get the results.
Okay, so as soon as we finish the class, I'm gonna send it
Mhm.
to you. I'm gonna see what happened, okay?
Mhm.
But I did
Yeah, and
resend.
did you send out the test for this one that you're talking about or not? I'm not sure.
Um,
Not as yet.
I sent the test for the class that we just finished.
Hmm.
Yeah, the
I didn't.
module.
I didn't get
Oh,
it. Didn't get it.
remember, the last module was medical office procedures. So still, you have time to complete it.
Yeah, but I didn't receive it.
Oh,
That's what
that's
I'm. Yeah, I haven't
okay.
received it.
Okay, let me go over that because that is not good. Yeah.
No, no.
So yeah, so I'm gonna check it out as soon the class is over. Can you do me a favor? Can you
Yes.
email me, please, so I don't forget?
Okay.
So you send me
Okay. Yeah.
an email says, Professor Hoyer, I haven't received the grade for this module and the test for this new class that we just finished.
Yeah.
Okay, not a
Yes.
problem, no worries. You
Because I
still
know
have.
we did touch base when I had sent it and you said you receive it and that was it. I haven't heard it. I didn't
Oh,
get
yeah,
any
yeah. That's
yeah.
that is something because usually when I receive it
Hmm.
and I grade it, as when
Hmm.
I'm grading it, I'm sending the email to each student that I'm gonna be grading it because I don't wanna
Uh-huh.
just grade it and leave it to the side because then I forget.
Uh-huh.
So what I do is
Oh.
that, yeah, no problem. Yeah, please just send me an email reminding me.
Uh-huh.
So
Uh-huh.
as soon as I finish the class, I'm gonna do both. Send you the tests for this past module and
Uh-huh.
send you the grade for, from AMP, I believe it was medical anatomy and physiology. That's what you're talking about?
Yeah, for the yeah, the finals and for this semester, for this exam here, I didn't get anything. I know you said last that you were going to be sending it out.
Yes.
So
Yeah, I
I
will
was
be I
checking
I
but
will be
didn't see
checking out
anything.
my emails and
Mhm.
regardless,
Okay,
I will
thank you.
resend it back to you regardless because if you didn't receive it, then I'm gonna make sure. That's what I want you to send me an email so I know that I'm gonna be forwarding you that information to that email. Okay. All right. Any other questions? So I have an announcement. Remember, this coming Monday is a holiday, so we won't have a class. There is no class this coming Monday. I don't know if you are aware of that, but I just checked my schedule and it shows there. So you're gonna have a long, long weekend. See? So that's gonna be good. Okay, any other questions? Anyone else? Hi, Mercedes, how are you doing?
Hi, I'm good. Thank you.
Okay, so yeah, I will be announcing through the class and at the end of the class, reminding you that, if you didn't receive the exam for this HAS module, medical office procedures, please let me know. And if you didn't receive the grades from anatomy and physiology for any of the tests, final tests that we have taken, please let me know. Just send me an email or something like that. Okay, so we are going to continue with this topic, medical law and ethics, the physician's-patient relationship. So just to recap a little bit, remember, this is a contract. This is a contract that the patient and the medical provider have, which it can be implied, it can be expressed or written contract. So we just went through that. The patient has rights and responsibilities. The medical provider has rights and responsibilities. We talk about that. The major responsibility of the medical doctor is to provide the care needed for the patient without bias, without thinking about race or religion or culture, or whether it has money or not to pay. Now, that was something that we left off last time when we're talking about the dumping crisis. So we're going to go over a little bit. So basically, that's what it is. The patient, the medical job is to provide care for that patient. But the patient responsibility is to follow the instructions from the doctor. Because if the patient do not follow the instructions from the doctor, then nothing's going to be accomplished. Remember, this is a relationship, 50-50 relationship. So that's how it works. So let's go back to here where we were. Physician responsibilities, we talk about that. During a medical emergency, we talk about that. Remember, during a medical emergency, we do not need a consent from the patient. The patient consent is going to be, it's not going to be written, it's going to be implied. So remember that. These are questions for exam. As soon as you see a question on your test and they ask you, you are the medical assistant, you are working in the emergency department. The patient has an emergency. Immediately, you know that these patients do not need the consent. The consent is implied. We assume that you need help because you probably cannot respond to questions. So we try to save your life. So questions about who you are, what conditions you have, what is the reason that you're here, these are implied. We assume that this person needs help. So we just take care of them. And when the patient recovers, when we stabilize the patient, or family members comes to, to the play, then we are going to ask questions. Other than that, we don't. So that would be illegal to make, to refuse treatment to a patient who is in an emergency situation. So that's basically what it is. So we have to really, really make sure that, we understand patients, inpatients, and outpatients or ambulatory settings, and when we are in the emergency. All these settings are different. And it's different when we go to a private medical doctor, to a private hospital, versus we go to a public hospital. Remember, public, we mean by a hospital that receives money from the government, not that some people get together and their own money, they're going to invest it right there, because that will be for-profit organization. So people that are for-profit organizations, unless it's an emergency, everything else, they're going to charge for it. And if you don't have money, we have the right to refuse treating you. So that is the difference. So you need to understand when you go to a medical doctor, these medical doctors are the owners of that office. They do not receive any funds, any money from the government to run their business. So they have the right to charge the patients whatever they feel or whatever the regulations are, whatever the policies are for the particular practice in the particular location. But if it is a public hospital, remember, public hospital does not imply that the public goes there. That's not what I'm trying to say. Public places, public offices means that they are run by the government. The government gives the money to run their businesses. So for that reason, if the government pays, you have no business whatsoever to charge someone or to deny or to refuse treatment just because this person doesn't have insurance because it's illegal, in general because he doesn't have money. So you have to treat them. Remember, these are non-profit organizations, so you have to treat them. In an emergency situation, it doesn't matter whether you're private or not, you have to take care of the patients regardless. So I just want to make sure that you have all that information. We're talking about this duty to treat indigent patients. Remember the homeless, the ones do not have money, the ones that do not have health insurance. We talk about this, but I wasn't very explicit telling you about the dumping crisis. Think about dumping someone. When somebody dump you, mean they don't want to know about you. They don't want to have you next to them. That's a dumping crisis because it's a crisis, it's a problem. Remember, we cannot discriminate patients based on religion, gender, culture, sexual orientation, disabilities, have or not have insurance, legal or illegal in this country. We cannot refuse to see patients. But once again, we have to take the considerations whether it's an emergency or not, whether we are in a public hospital or in a private hospital. So all those things plays a big role. So that's basically what it means. So yes, medical doctors have the right to see whoever they want. If you don't have money, you come to my clinic. I put my money into my business. It's like if you go to store, to grocery store, and this owner pay for everything that they have there, and you cannot go there and says, oh, can I have this, and that? And then you're gonna say, oh, I'm sorry, but I'm not gonna pay. The government has to pay you for that. It doesn't work that way. These are for-profit organizations, for-profit businesses. So you have to pay. But except in the hospitals, when it is an emergency, it doesn't matter whether it's private or whether it's public, you have to, you cannot refuse to take care of the patients. In other circumstances, yes. We talk about let's rewind a little bit. If we refuse to take care of patients that we were supposed to be taking care of, we are going to be liable. We're going to be accused, sued for abandonment. Remember, abandonment means you abandon someone. You are not taking care of them. We have a contract. You are my patient. And I have not withdrawn my services from you. And you are still within the period of time that I gave you, 30 days, to withdraw your services. I have to see you until then. So you cannot refuse to see me for no reason. Now, remember, if you are not following the medical doctor guidelines, the medical doctor policies, instructions, now I can withdraw my services, but I cannot just say, hey, I don't want to see you anymore. Don't come back to my office. like an employee. You can fire them whenever you want. It doesn't work that way. So you have to give them prior notice and are 30 days by law. It's not 25 days, it's not 2 weeks, it's not 3 months, it's not 9 months, not 1 year, 30 days. Period. What is considered abandonment? If you do not contact your patient, I mentioned it yesterday, you do not contact your patient after you prescribe medication. The patient did not return to the office. You don't contact them to see how they're doing. That's called abandonment. You do not contact the patient because they cancel or they just did not show up to an appointment. You don't contact them to reschedule the patient. That's called abandonment. You go on vacation, you don't inform your patient that you go on vacation. Once again, you're not asking permission. You are letting them know, because if something happened to this patient during the time that you are on vacation, you are going to be responsible for it. That's abandonment. So remember, we are liable for a lot of things. Yes, the patient doesn't want to come to our office, but patient is taking medications, patient has gone to a procedure, and I'm not contacting to see how they're doing, I'm liable for abandonment. That patient is my client, so I have to be on top of them. So now probably some of you are thinking, just like I was thinking before I became a doctor, well, I don't go to the doctor. I go to the doctor every year or whenever I feel like it, not because I'm sick, it's only because I want to complete physical exam. What about that? Well, doesn't apply, because remember, I'm not taking medications. I have not gone to procedure. I didn't make an appointment and cancel. That is different. And I didn't show up to an appointment. I didn't fail to go to a referring physician. No, if I'm not taking medication, the medical doctor says, oh, this guy is good. So I can go every year, do my physical. You don't have to be calling me during that time. But if this patient has concomitant conditions, meaning chronic conditions, then you have to, your office have to contact you and document it in the medical records. Failure to do that is called abandonment. These are common questions for exam. So the patient failed to call, reschedule a patient. What is the medical doctor or the office liable for? Abandonment. Think about somebody do not call you when they're supposed to call you. Oh, you abandoned me. You forgot about me. But that's what you have to remember. That's what's going on. So don't forget about abandonment, because common questions. It's like assault, battery, felony, all those things are common questions. Okay, let's talk about these patients that have HIV or patients who has AIDS, because we have to make the difference. Okay, so a patient who has AIDS is someone who already have HIV. So let me see if I have HIV patients right here. Oh, we have a little further for testing. So duty to treat patients with AIDS. Now, in order for that, because we all think that, we know exactly what AIDS means, not what AIDS stands for. We're not talking about that. So in order for you to develop AIDS, you must have been contaminated with the AIDS virus, so HIV. So you have to be HIV positive in order for you to develop AIDS. Let's make a little comparison. You've been diagnosed with cancer. Oh, you have HIV. But you've been diagnosed with a terminal cancer, with a cancer who had spread already through your body, meaning there is nothing we can do. We're just waiting for the time for you to go. There is no cure for AIDS. So that's it. There is no cure for an advanced cancer. It's cancer that has already metastasized. There is no cure. We're just waiting for you to die. That's it. Period. That's the same with a patient who has HIV. You just have the virus, but that can be controlled with medications. So that we do not allow that virus to become AIDS, because AIDS is when this virus takes over your entire body, meaning your immune system. This virus, HIV virus, will destroy your defenses. So because you don't have defenses now, all your white blood cells are dead. And because they are dead, anything, a flu can kill you. A mosquito bite can kill you. Anything can kill you. Because your body has no defense. Because you have AIDS, because you have no immune system. Your immune system has been destroyed by the virus. So here's the thing. Medical doctors should not refuse, deny treatment for patients, whether they have HIV or they have AIDS. It is illegal. That is discrimination. That's like, oh, I'm not treating you because you are this race, this gender, this sexual orientation. It's just like saying like that. So it is illegal. So once again, medical doctors should not do that. If you feel like you're being discriminated based on these grounds of having a condition and that your doctor don't want to see you, you can sue that doctor. So that's basically what it is. Now, one thing that for sure medical providers needs to do is, if I do a blood test, has to be voluntary, that you want to. So let me explain you what I'm trying to say. You go to the medical doctor. The medical doctor is gonna offer to you if you want an HIV test or not. They have to offer it to you. They cannot just run a test without informing you, and you have the right to refuse. Remember, patients have the right to refuse for everything. But if I order blood tests, see, go get glucose, cholesterol, get vitamins, get tests for arthritis, get tests for anything, all these electrolytes. For not a problem. I don't have to tell you, listen, I'm gonna treat you for glucose to see whether you're diabetic or not. Yes or no? No, we don't ask that. I'm gonna do a test to see whether you have arthritis or not. You want it or not? We don't ask that. But for HIV, we do. For a surgical procedure, we do. Because we have to ask for your consent. So to collect an HIV blood test, we have to discuss it with you, because there are legal things right here. So first of all, I have to tell you that I'm going to offer the test. Remember, it's offer. It's not that I'm going to tell you, oh, listen, you got to do this. You must do this. No, I'm going to offer you, listen, according to, whatever symptoms, whatever situations you are in right now, I suggest that you should get an HIV test. If the patient said yes, not a problem. You're going to fill a form and the patient is going to sign it. Now, before you do all that, your medical doctor has to walk with you. He's going to walk you through certain steps that are going to happen. So remember, this is not just do the test. Ah, yeah, do it, no problem. No, you have to tell me more, because here is where the legal part comes to play. Your medical doctor is supposed to tell you, okay, Mr. Mrs. Brown, you agree to get the HIV test. There are certain things that you need to know. If the HIV comes negative, no worries, nothing happened. But if the HIV comes positive, then this is what's going to happen. I'm your medical provider. I have to report this test to the CDC. have to report that you are HIV positive to the CDC. That is mandatory. That's how we keep all this data, all this information about who has what and where. So that's basically what it is. So that's one of the things. We're going to report it to the CDC. And the CDC is going to report it to the World Health Organization. Who? So you know already. So I'm not violating your privacy. I'm telling you in advance because this is my job. This is my obligation because this is a communicable disease. This is a disease that if you have it, you're going to be passing to other people. And we don't want that. We're going to start you with treatment as soon as we get the results. If it is positive, we immediately going to start you with treatment. One more thing. You gotta let know your partners, your wife, your husband, whoever you were dealing with, whatever you been sleeping with, so to speak, you gotta tell them that you are HIV positive. Oh, well, they're gonna change their minds, right? They're probably gonna say, no, I'm not gonna do it. If you don't do it, the doctor is gonna explain it. If you do not do it, then we're gonna tell your family. The family or the people that you are involved with, the people that we have in our records. And if something happened to someone of those and you do not release that information, you're going to be liable for that. You're going to go prison for that. So this is very serious. This is not just, okay, do the test and that's it. But remember, if it comes positive, that's when we're going to talk about this. So it's very important for you to understand that HIV testing is not like simple thing. It's not like, oh, like do any other routine tests, if you will. So these have a little more to it. Because remember, we have to disclose this information. And this information, you can disclose it without the patient permission. But now that I have spoken to you, explained the process, now you know it. If you refuse, not a problem. Still, we're going to report it because reporting the case is not part of the deal. If you don't want to tell your family, we are going to tell the people that we have on file. The hospital is responsible for that because if you start sleeping with other people and passing the disease to other people, that's going to become a crisis. So that's going to be really bad. So for that reason, we protect our community. So here it is what I was telling you. Ethical considerations when treating AIDS patients. This is not just AIDS patients, it's HIV patients. Just the fact that you have the virus, you can pass it. You are a carrier, that's what we call it. You carry the virus. So if you have sexual intercourse or blood transfusion from that person or some type of body fluids interchange, you're going to be exposed. So we're going to encourage patients to inform his or her partner. See? It's not just encourage. We're going to tell you, okay, if you don't do it, we're going to give you the choice. Notify authorities if concerned that the patient will not inform others. See, that's when we go and inform, not the CDC only. That's just for the records. That's just to keep all this information there. But we're going to inform someone who's going to go and, talk to the family, the partners, whoever are known, and they will disclose this information. You are not violating the patient's privacy and confidentiality. It says right there, a last resort, notify patient's partners. That's not the last resort. Well, the last resort means that if you don't do it, then the medical professionals are going to do it. So this is serious with HIV. So you have to know that. So whenever you have a patient who has HIV or AIDS and you're aware of that, you got to follow all the protocols to make sure, that you just don't refuse to take care of the patient, but you have to focus on the job that you're doing because you never know that you're going to poke yourself with a needle or some other things. So be careful. Just shaking hands, it doesn't, just talking to someone, just sitting next to them, these diseases do not pass like that. It's got to be through some body fluids. Other than that, very, very intimate. Other than that, it's not. I have been taking care of tons of patients with HIV. So it's just taking care of yourself when you're doing the work. But the point here is that we cannot discriminate based on this condition. Remember, people are very afraid of, people who has these conditions. But what if you do not know that the patient have it? That's why we have to treat every patient as if they were contaminated with something. That's what I tell my students every single time that I teach phlebotomy. Always do the right thing for yourself. Focus on what you're doing. If I'm dealing with this patient, I'm going to be focusing on drawing blood on these tubes and making sure that I process all these correctly and no missteps are going to be jeopardizing my job, probably my life. So basically, that's what it is. Okay, it says right here, exposure of healthcare workers to patients' blood. I talk to this all the time during phlebotomy. So there are two things that you can get very easily if you poke yourself with a needle from someone who has certain conditions, particularly hepatitis B and HIV. So think about this. If you accidentally, because we put it that way, because nobody on purpose wants to do that, right? If you accidentally poke yourself with a needle, with a lancet, with any sharps, or handling any of these specimens from a patient that has HIV, chances that that puncture, that stick that you develop with accidental stick that you develop, you're going to have 0.3% risk of contracting HIV. That is a lot. 0.3%. HIV is zero. That is with HIV. But if you get stuck with a needle or with a lancet that contains blood or any body fluids from someone who has hepatitis B, it is 3%, not 0.3%. 3 people out of 100 will develop the condition. So which condition are worse? HIV, of course, versus hepatitis B. But which condition you are more at risk of contracting? Hepatitis B. So don't forget this, because these are questions for exam. They're not going to ask you all the things that I told you. They're going to ask, okay, which of the following conditions are blood-borne pathogens? So immediately you're going to look for hepatitis B, HIV, because those are the ones that you are more at risk, because we have a lot of conditions that are transmitted to blood. But these ones for phlebotomies, for the medical providers, because you're going to be in contact with blood. That's why when you start working, you have to be Hep B vaccinated. So you have to have the 3 shots of hepatitis B. And if you don't have it, then the hospital that hires you has to immediately give you the vaccinations. And if you don't want them because of your religion or whatever else you believe, you don't want to be vaccinated for hepatitis B, well, guess what? You will not get the job. Or they will ask you to sign a waiver. A waiver is where you are responsible if anything happens to you in the workplace. You will not make the office, the institution responsible if something happens to you. You get hepatitis B because you got an accidental finger, hand, or whatever stick when you were working with the patient's fluids. You cannot come and say to the hospital, hey, I developed hepatitis B when I was in your job, so now you have to compensate me for that. I said, no, we're not owing you anything. We have this waiver that you signed because you did not want to get the hepatitis B. So that's it. Unfortunately, we don't have vaccines for HIV. Well, they are in the process. They say that probably they have it. They have the cure. We don't know yet. It's very recent, but we don't have at our hospital hepatitis, HIV vaccines. So there's no such a thing that you're going to go there and they're going to offer you that. Or when the child is born, give them the vaccine. We don't have it yet. So be careful with all this. This is legal things. For that reason, we're talking about that. Law and ethics. So here are some devices that the needles have to prevent needle sticks. So these are these guards that protects the needle. So whenever you're working with needles, for those who did some phlebotomy with me, you know that these needles have some safety devices to kind of hide the needle after we complete the draw, because we don't want to expose this needle to ourselves or to someone else, because the risk of, passing these conditions or these infections are very high. Duty to properly identify the patients. Well, let's talk about, remember, I've been talking about this all the time, ambulatory patients, outpatient, ambulatory means the same, inpatients and emergency patients. We see them in different levels. So if you have an inpatient, you're gonna check the arm or the wrist band. Remember, always, phlebotomy and EKG, I always teach this. Why? Because these are common questions. How are you going to identify the patient? How are you going to make sure that you're not doing a procedure on the wrong patient? Well, there are ways to do that. So if the patient is an inpatient, meaning is hospitalized, we're not going to ask names. Remember, this person is under medication. This person probably cannot talk, probably cannot understand, is under the influence of all these medications. It is sick. That's what is admitted. So we are not going to go and trust what the patient tells us. So we put there an arm or a wristband. The little babies, remember, they have an ankle band. So again, we gotta be on the lookout whenever you see the questions, because that's the key. You are a medical assistant, you are working on inpatient. It's gonna say it because that's the key. How you are going to identify your patient. Oh, you're gonna ask them for the name. Oh, you're gonna call them their name. Or no, if it is inpatient, you're gonna look for a barcode, an arm or wristband, or an ankle band on the little kids, the infants particularly. Now, if you go to the medical doctor and I wanted to verify that you have insurance and that insurance belongs to you, I can ask you for your driver license. So actually what you're looking for is for a photo ID. But you know that driver license is a very, very common ID that we carry. Most of the time, no one is going to ask, okay, what did you show me your social security number? Show me your residency. Oh, can I see your passport? Unless we are in the airport, we will be asked about that. But in any other setting, driver license is the key. So again, we gotta be very, very cautious. We talk about the sign-in sheet. Remember the sign-in sheet when the patient comes to our office? We got to be very discreet. Remember, I told you already, these sign-in sheets, only you have to put your name, the time of arrival, and who is it that you want to go see, if they have any other doctors. But your name, last name, and time of arrival, that's it. We should not ask or request for any other information because other information is confidential, and everybody who comes to that place and sign in is going to read what the other person, the information from the other patient or the information that the other patient have entered. So we are refraining from that because that will be violation of HIPAA. That happened years ago. We used to do that. I work here when, you ask, okay, what is the reason? And then what is the reason? And you have to explain there. So that was removed because HIPAA violation. Now, if you are in an outpatient, because you're going to see on the question, or ambulatory setting or facility, now you're going to ask for the patient to state their name. Remember, you're going to ask the patient to state his or her name. You're not going to tell the patient, are you Maria? Are you Maria Rodriguez? Oh, yeah. Well, even though if they are not, they're going to say yes because they want to be put first. So now you're going to have an issue because you're going to go there, you're going to bring the medical record, and the doctor is not going to ask the name. Some of the doctors, they just assume that you brought the right patient. So not right. That is not the way to go. So you're going to ask, oh, hi, may I have your name, please? And last name? And if you have other people with the same name and last name, can I have your date of birth? Because remember, we have 2-point identification. Questions for exam. How many points identifications do you have in an outpatient clinic? Because remember, it's outpatient, not inpatient. You're going to say 2. Any questions? This is really, really important for you. So I'm giving you answers to your questions on your exam, but at the same token, teaching you how you have to deal with all these issues in your workplace. Duty to tell the truth. Okay, we mentioned this yesterday, but we mentioned this from both sides, the patient and the doctor. So the patient has to tell the truth in regards to their medical condition, their medical history, whether it's social history, whether it's medical, whether it's family history. Have you have any surgeries in the past? Have you had this or that? Have you been taking any medications? Are you currently taking any medications? Now we have to be specific because sometimes the patient thinks that medications means what the doctor prescribes. But whatever I get over the counter, whatever I get like herbal things, oh, that's not medicine to you. Yes, they are. So we have to explain the patient, including over-the-counter medications, home remedies, if you will. Tell me everything that you have taken, because all this is going to make an effect on your health. And if I don't know everything, then I'm going to dismiss. Family history. If you have family history that has any conditions, you have to let me know if you are aware of. Do you have a family that has cancer, colon cancer, breast cancer, cervical cancer, brain cancer, stomach cancer, liver cancer, whatever cancers, other? And if you're aware, check. And then I'm going to ask you who? Father, mother, brother, any sibling, any close relatives, grandparents. So you have to check it out. You just check. Because depends on your history or your family history, I'm gonna make different decisions. Because sometimes we have to do evaluations, we have to order tests prior to you reaching certain age. See, colonoscopy has to be done after 45 or 50 years of age. Now, you tell me that your father died from colon cancer. Oh, wait a minute. I had to start your colonoscopy at age 30. Because when your dad dies at 45, it was too late. When the cancer spreads all over, when it becomes metastasized, it takes between 10 to 15 years. So all these 10 and 15 years, you didn't feel anything. But now that you have a family member that has cervical cancer, that has breast cancer, colon cancer, and they die young, or they are currently alive, but they are, in very bad state of health, we're going to run those tests prior. But if you don't let us know how we are going to run a test in advance, because that's to prevent something from happening later on. So that's basically what we need to understand. Okay, so that's duty to tell the truth. That's for the side of the patient. Now for the side of the medical doctor, remember, medical doctors has some principles, some duty, some responsibility of keeping the patient's private, the information private and confidential. But now you should not promise the patient things that unforeseen, things that you believe is not true. Remember, as simple as when the patient comes into our office. The patient comes in, is very stressed out and, thinking, having all these bad thoughts about probably dying, probably leaving the family without support. And you tell them, no, don't worry. Everything is going to be okay. You're lying. What makes you sure that everything is going to be okay? It doesn't happen that way. You're going to tell them, if you want to say something, listen, don't despair. The doctors are going to do whatever it is in their power, to make the things a little better. Because things are not going to go back to original. Your patient is not going to be going back 20 years back when you didn't have any disease. That doesn't happen. It is impossible. You are 20 years older. Just the years that your body passed have already taken it all. Plus the conditions. So you're not going to bring back someone to become younger when they are already old. That is not possible. So a condition that has already, take over most of the part of the body, you're not going to say that you're going to fix it, because that doesn't happen. We're going to control that this condition, we're going to slow down the process. If you have headaches, we're going to give you medications to make you, not to make you feel the headache, but the problem is there. We're not removing the problem. No, it's not. Because the source of the problem is something else. So we got to work on that. And if we do not work on that, or that part does not have access, like the brain, who's going to operate on the brain just because you have a headache? Because it's going to be worse making a surgical procedure on the brain. So again, medical doctors should not, tell or trying to make the patient better to tell something that is not true, because that doesn't work, regardless. Now, the doctor should not lie to the patient saying that everything is going to be okay, but the doctor should not also hold information if everything is bad. You already have a cancer and it's a level 3, 4, really bad. Oh, no, I don't want this patient to feel even worse by telling them the truth. No, so I'm gonna hold it. No, you have to tell. Even if the family tell you, Oh no, please do not tell my father, my mother, my son, my sibling, my relative, whatever the case may be. Don't tell that news. That's going to kill them faster. Don't tell the bad news. Well, your duty is to tell the truth. So again, you got to do what you got to do. But those are the main points that you have to, follow. So we cannot hold anything back. So if something has to be said, you have to tell. And again, we do not lie to our patients either. You shouldn't tell the patient. Should not make promises. Not at all, because we don't know what the outcome is going to be. Okay, so someone is explaining, the physician is explaining laboratory test results to a patient. Well, that's our job. Remember, this is mostly just to depict whatever we just discussed, that you have to tell the truth. If the things are not good, not looking good, tell the truth to the patient. If things are going well, exactly tell the same. Don't tell someone, oh, you have a very serious condition, when you actually want to order a test that is very expensive and you're going to make a lot of money ordering a test, but actually the patient didn't have anything serious. So you're lying because it's for your own benefit. That is not a good thing. Remember, that's called fraud and that's called malpractice. Patient rights. Now we know that we have rights and responsibilities. So what are the rights of the patient? First, right to give informed consent. Think about this, because consent and informed consent are two different things. See, consent by itself, I'm giving you permission. When do we give consent? Okay, I'm gonna draw your blood. Sure, not a problem. Draw my blood. Why? It's just a consent. You're saying agree or disagree. Remember, do not confuse informed consent with a consent. Hey, I'm asking you permission to leave early. That is a consent. Yes or no? Or you said, okay. Oh, why? Not a problem. Nothing is going to happen because you leave early or else, or because you ask for a day off. Informed consent is used when you're going to do something that carries risks for the patient. So let's say that I'm going to do a surgical procedure. During that surgical procedure, the patient can die. The patient is going to bleed. The patient is going to have to be on rest, on observation for this period of time, has to take some medications. You have the risk of getting an infection, of bleeding. So, or that the surgery didn't go well, the patient can die, or the patient is going to be amputated. Something happened. So because there are risks, I have to inform you. So I have to give you a details about the surgical procedure. So that is different. So remember, consent, if a patient comes just for blood, for an EKG, to do vital signs, just to do simple procedure, that the patient is not at risk or losing their lives or losing something on their bodies, functionality, then we need just a consent. But if we put the patient at risk, needs to be an informed consent. Remember, informed means that you are informing me all the things that are going to happen, the good and the bad. So we're going to discuss it later on. So that's informed consent. So the patient has the right to receive informed consent, meaning you have to tell me what is it that you're going to do. And I'm going to determine if I want to do it or not. Because the patient has the right to refuse treatment, which is here. So we're going to put everything together. Refuse treatment. If I don't give you my consent, I'm going to say, you know what? By the way, I don't want the procedure. I don't want to do it. If it is a consent alone, either. If I don't want you to draw my blood, I'm gonna tell you, no, I don't want you to draw my blood. Period. I don't want you to do an EKG on me. I don't need it. I don't want you. It's my right. But with this informed consent, it's because there are risks. And when there are risks, the patient do not want to do it. Think twice before they go for the procedure. So, oh, here it is. That's what I was telling you. Right to be informed of advantage and potential risks of treatment. So that is when you do something, okay, I'm gonna be doing a surgical procedure on your kidneys, on your liver, on your pancreas, on the stomach, the colon, whatever organ inside the body, in your arms, in your legs. But there is a possibility that, you're not gonna be able to walk. You're not gonna be able to use your arm. Then we must have to amputate your arm, your leg. We might have to remove this organ. We might have to do something. So there are advantage and disadvantage on a procedure. And you have to tell me everything, the good and the bad. Oh yeah, you're gonna be able to do this that you used to couldn't do, but you also can face this and this. And it has to be written. It's not that you're just gonna talk to me. No, it has to be written in an informed consent document that you explain everything to me, and everything that you told me has to be written. Now, if I'm agree, I'm gonna sign it. If I'm not agree, I'm not gonna sign it. I'm gonna refuse. I'm not gonna do it. So basically, that's what it is. So patients have the right to privacy, of course, not only to their information, but to their bodies. You're not gonna expose me, you're not gonna do this. So privacy. Right to confidentiality, all the information that I reveal to you, that I disclose to you, medical doctor, needs to be privileged communication, meaning it is like a confession. You're not supposed to be releasing this information, but you can use this information to, you can disclose this information with the people that it is involved in your treatment. If I'm working with you doing something, how you're not gonna know what's going on? Well, you should know, right? Because I'm working with you for the patient. So you should know. What I'm trying to tell you is you should not disclose this to someone independent from the office. They have nothing to do. You're not gonna tell another doctor, oh, listen, I was operated on this patient is such and such name, and lives this, and it's like this, like that. There is no grounds for that. So that's violation of the patient's privacy and confidentiality. And that goes for the doctor too. It's not just us, everyone. That information should not be disclosed without the patient's prior authorization. So those are the rights of the patient. We know already what is confidentiality. Remember, these are questions for exam. The right of the patient to not disclose their information to no one unless the patient itself or herself, authorizes to do so. All information and records about treatment will be kept confidential by physician and staff unless consent to release is obtained. So the only time that I'm going to be releasing my patient's information that is not pertaining to the patient care, meaning with my colleagues that are going to be intervening or going to be participants of the procedure, unless they are, anybody else should not know it. Another third party that should know this, not all the information, but diagnosis and procedures, that's going to be the insurance, health insurance that's going to pay for it. They're going to know what they're paying for it. So we're going to disclose that information to them. We're not going to disclose the whole history of the patient. We're going to just say patient was diagnosed with HIV, patient was diagnosed with diabetes, patient was diagnosed with colon cancer, breast cancer, cervical, something like that. We're going to put the diagnosis there so we can get paid for it. That is it. But all the other information is going to be there. So that's basically how things works out. So says right there, Medical Patient Rights Act, all patients are entitled to have privacy respected and medical records handled confidential. Now, again, not only the medical records, all the patient's information should be handled confidentially, privately. Period. Remember, HIPAA. HIPAA is the one that protects the patient's privacy, confidentiality, and security. How we save, how we protect that information. Privileged communication, confidential information told by a physician or an attorney or by a patient. Now, again, if I'm telling you my medical conditions to you, you have to keep that information sacred. It's going to be privileged. So if you don't do it, then you're violating HIPAA, which is the organization, the federal organization that protects my information. So again, it's like when you tell your attorney certain things, this attorney needs to keep the information for themselves. And I'm telling you so you can protect me. I might tell you the truth. Listen, actually, I killed the person, but you're going to defend me and you're going to say, no, that I didn't kill the person, and you're going to do the best that you can to get me free. So that's basically what it is. So the attorney knows that you're a criminal, but they defending you anyways, because the information that this person released to you has to be kept privileged. That's basically what it is. Now, who deals with that? HIPAA regulations. So what is HIPAA? What HIPAA stands for? Health Insurance Portability and Accountability Act. Almost every single subject in medicine talks about HIPAA, talks about OSHA, safety organization, safety in the workplace. So we're going to talk about this all the time. The CDC. So again, the Centers for Control Disease, this federal agency that has to do with the health of the population. So those terms you need to know, you get familiar. You have like 5 questions about HIPAA. But remember what HIPAA does? Privacy, confidentiality, privacy, confidentiality. You are the medical assistant, you are dealing with the patient, then one of the family members asks you, okay, so what's wrong with my family member? What's wrong with my wife, with my daughter? Sorry, I cannot disclose that information. The answer is not talk to the doctor. That's not the right answer, because the doctor is going to tell the person the same. I'm sorry, but this information is privileged. This information is only to the patient. If you want to know, you got to ask the patient. The patient has to tell you, not me. So the right answer is I cannot disclose that information. I'm not authorized to disclose that information. According to the HIPAA regulations, I should not disclose this information. Period. You're not going to say, oh, well, I cannot disclose that, but go talk to the doctor. The doctor is going to be very upset if you send someone over there, because the person is going to say, oh, but that person in front, the nurse, the medical assistant, told me that you can tell me that information. But that's false. That doesn't work that way, because the doctor is not going to tell you. You're not the patient. So I'm not going to reveal the patient's information to someone else, whether it's the mother, the father, unless it is a minor. Those are different regulations. We will discuss that later. So remember, HIPAA is going to be all the time. You are working in a computer and your boss come over and tell you, oh, listen, oh, let me go inside in the computer. I need to check some information from my patient. Would you allow them to go into your computer, into the computer? That computer belongs to them. It doesn't matter. Sure, doctor, not a problem. You log off. Now you can have the computer because you are logged in, and anything that happens during that time, somebody else is using your computer, whatever they do, that's going to go to you. So you will be violating HIPAA because accordingly, you're using your passcode, your login, and you're not authorized to do certain things. And you don't know what the other person is going to do. They might get you in trouble. They just want to protect themselves, not using the login password, and they're going to use yours. So it doesn't matter because one of the things that we always are concerned about is like, oh, no, this is the doctor. Oh my God, this is the owner. He's the one who hires me. And he says, oh, good, move to the side. Now that you have the computer on, let me go do something that I need to check my patients. Yes, you can say, no problem. I just hold on a second and you log off. Is that understood? Do not get in trouble because believe me, that will be violation of HIPAA. Okay, so any questions? Anybody, anything up to now? Okay, so moving on. Let's talk about this part that is very, very interesting. Oh, still time. This is called the Patient Self-Determination Act. You're gonna have questions for this too. So think about how important it is, all the rights that the patient has. That's what it says, Patient's Self-Determination Act. So Patient Self-Determination Act is nothing else than, an act that states that you as a patient, you have the right to determine what can be done to you in case that you cannot make decisions for yourself. So that's the Patient Self-Determination Act. So I have the right to determine what can I do with my body. It's not the government has to decide. It has to be you. This is not raw and way what is being discussed in the politics about abortion. We're not talking about that. We're talking about I'm getting sick. I'm not pregnant. I'm just sick. And I might die. So before I die, I write down some documents authorizing someone. Might be the doctor, might be a family member, might be an attorney, might be my own wishes that I'm gonna leave it documented. So if something happens to me and I cannot make decisions for my health, then here the document is gonna do it for me. This document is gonna speak on my behalf. So that's the Patient's Self-Determination Act. There's always documents over there that we can complete, that you can fill out and have it in the patient on the medical records. And if something happens to you, then they're gonna know what to do. So that's basically what happens. So we are going to talk about here like 5 issues, 5 situations, 5 documents that we can complete that can be used as our wishes if just in case something happened. Number 1, advance directive. As the word implies, think about it, advance is something that I'm doing before something happens to me. So I'm gonna direct in advance a document. I'm gonna write down, I'm gonna document in advance. So I'm gonna direct medical professionals, family members, friends, whoever you decide are gonna be making decisions for you. What is it that I wish to be done if something happens to me and I'm not able to make those decisions? That's what is called an advance directive. So which advance directives do we have? We have something that is called living will, something that is called do not resuscitate or DNR. We have something that is called durable power attorney, and we have something that is called uniform anatomical gift act, and we have others. But these are very important. And this comes in exams. So they're gonna ask you which is the name of the act where you describe your wishes. What is it that you want to be done, just in case you cannot make decisions for yourself, but they're asking you for the act. So then you look for the Patient Self-Determination Act, or PSDA. So that's simple, just like that, because you're gonna be asked. Every patient has the right to decide what can be done just in case they cannot make decisions for themselves. What act determines that? Oh, the Patient Self-Determination Act. Now, let's talk about the living will, because this is very important. We're going to go one by one so you can understand the difference between them. They probably, you probably confuse them, mix them up, thinking, oh, all are the same. No, they are not the same. They are totally different. They have something very critical that you have to pay attention. So let's talk about advance directives. It's a legal document. See, first of all these Patient Self-Determination Act documents are legal. So we have to honor this. We cannot change them, except the patient can change them at any time, but nobody else can change it. We have to follow exactly what this document wants, because these are the wishes of the patient. So it says right here, what is an advance directive? Is a legal document by which you may make provision for future healthcare decisions in the event that you are unable to make such decisions for yourself. So you don't know what's going to happen in the future. We do not know. So let's say that, you have one of these papers, you don't have the paper. And then you got, rolled by a car. You end up in emergency. They're going to do anything to save you. And then they amputate your legs or your arms. And then you survive like that. And you're going to be miserable. And you're going to say, wow, if I knew that this was going to happen, probably I have written some documents saying that if something like this happens, I don't want the medical doctors to do anything for me. If I'm not going to be complete, if I'm not going to be able to talk, not going to be able to walk, not going to be able to use my hands, my arms, so then I don't want to live. So that's basically what it is. You want to live, you're going to die, so then you should make provisions prior to that. That's what these advance directives are all about. And this advance directives has a healthcare proxy. What is a healthcare proxy? A healthcare proxy is an agent. It's someone that you're gonna choose, that you're gonna decide who you wanna appoint. Someone that you trust, of course. You want someone that you trust to make decisions for you. Can you imagine your husband, your wife wants to divorce you? They are sick and tired of you, and you have a little something incident, say, no, don't do anything for them. You're not going to put someone like that. You're going to put someone that you trust, someone that you think that will do the best for you. So when you appoint an agent, see, an agent, which is someone that you trust to make health decisions in the case that you cannot make decisions for yourself. That's a healthcare proxy. So advanced directives, healthcare proxy, this is what we are going to be talking about. So you're going to decide whether your wishes, you are going to determine what do you want to be done, or you're going to appoint someone to do that for you in the event that something happens to you. Now, these documents must be in the patient's medical records. What is the purpose of having this document and you have it in your home? The medical doctors do not know anything about it. So if you happen to end up in a hospital, they're just gonna do whatever they feel that is the best thing for you. But we don't have your wishes, so we have to have it. So before these documents are honored or granted, the doctors needs to evaluate that this is a legit document, that the patient is actually in a very serious condition, that the patient actually cannot make decisions for themselves. If the patient is conscious, the patient is talking, it is good on mind, well, the patient is gonna say, no, I don't want this to be done, but I have a paper right here. No matter, it doesn't matter. It's in the case that you cannot make decisions where these documents are gonna be playing a role, not otherwise. So think about it. So let's talk about the first document. Do not resuscitate. This is called the DNR. Remember, DNR, do not resuscitate. D for do, and for not resuscitate for is R. This is an acronym. Now, this is a legal document. Once again, this is a document that in which the patient leave or appoints the medical doctor. So here, pay attention because this is the difference. The medical doctor make arrangements with the patient, or the patient make arrangements with the medical doctor. And the patient tells the medical doctor, listen, doctor, I'm gonna sign this document that is called do not resuscitate. In case that I have problems with my heart, this is heart condition. I have a heart attack. I don't want nobody to do CPR for me. I want you to let me die. I don't want you to put intubation tubes. I don't want you to be intubated. No oxygen, no nothing. Let me die. Period. Who signed this document? The doctor. Who's gonna follow these orders? The doctor. That's what it's called, do not resuscitate. Remember, CPR means cardiopulmonary resuscitation. This is what we do when we put the palms of the hands on the patient's chest and start kind of squeezing the heart, the major blood vessels, so we can provoke, circulation, just to keep the patient, you have to buy some time for the patient to be seen by medical professionals. Because if there is no blood moving through the heart because you have a heart attack, the heart is not working, now I have to do it manually, at least to keep the heart functioning. Because if the heart dies, that is it. So this person tells the medical doctor that in case that they have some problems with the heart, they should not be revived, they should not be resuscitated. Resuscitate means revive. I'm dying, I'm having a heart attack, let me die. These are questions for exam. So who signs the DNR? Physicians. What is the DNR? It's a patient self-determination document. It's a legal document. So that's basically what it is. It's the patient that instructs the doctor not to do this. It's not the doctor that is telling the patient. No, it's the patient's wishes, the patient's choice. And this is not during a heart attack. This is prior to the heart attack. When the patient is feeling okay, we don't know what's going to happen. You are preparing just in case. So this is one of these healthcare proxies, one of these direct advanced directives. Who is the proxy right here? The medical doctor, because that's my agent. That's the patient that I appointed to take decisions, to make decisions for me in case that I have a heart attack. Any questions about DNR? Living will. So here I have a document. You can read it whenever you feel like it. But what is exactly a living will? Well, a living will, once again, is part of the the self-determination, a patient self-determination act. I always said the PSDA. So this is a document. Now, living will, be careful. This is not this living will. This is not a will. A will is when your family member leaves all the assets to someone in the family or to whoever they want to leave it. That is not a will. This is a living will, living my life. It has to do with life. So that's basically what it is. Here, the patient signs a document. The patient signs, the patient itself, these are my wishes. I don't want to be intubated. I don't want to be resuscitated. I don't want you to do anything for me. If I come across this situation, I don't want you to do blood transfusion. I don't want you to do surgical procedures. I don't want you to amputate anything. Let me die. So this is the patient's own words and the patient signs. The other one is the patient's own words, but appoint someone to make decisions for them. See the difference? Here is this document. I am telling you, this is what I want to be done if this happens to me. I don't want to be saved. I want to die. Well, they're not going to say it like that, but just don't do anything for me. Let me die. That's a living will. The patient say it, write it, and sign it. Of course, you're going to sign it in front of a witness. We always want to have witnesses. Because remember, somebody can coerce the patient to sign a paper, but actually the patient didn't want to do it. So you have someone who signed right there, and this is the person that we are going to investigate. So that's the living will. Remember, here is the patient. This is my own words, and I sign. I'm authorizing you. This is me talking if something happens to me. I'm not appointing anyone. But the doctor sees this document, he says, oh, it was signed for this person. We're going to do whatever is there. That's it. So we have to have this document on file, or someone else bring it to the hospital because it was signed. Living will. So you see this, the difference between all these healthcare proxies or advanced directives is the DNR, the medical doctor is in charge. He is the one who decides that the patient should not get resuscitated. That's the agent. Here in a living will, there is no agent. The agent is the patient own words, the patient's signature. I want. The other one says, yes, this is me, but I want someone to make decisions for me. This is me speaking. That's it. Nobody else needs to make decisions. They just have to honor this document, whoever it has, which is the hospital. Power attorney. Think about this. It says right there, power of attorney. It's telling you who is appointed to make decisions for me if I'm not able to make those decisions. An attorney. So you're gonna hire an attorney and you're gonna tell your attorney because you don't trust anyone else. You don't trust your family. Because remember, in any of these documents, if I appoint you as my attorney, my family has nothing, nobody can make decisions, change anything. Those are my wishes. So my attorney is going to bring this paper if something happens to me and I cannot make decisions for myself. It's going to say, okay, so my client stated this. This is the document we don't want to do. But this person is going to determine what can be done, what cannot be done. Because you're going to be instructed, listen to your best of your knowledge, to your best of your concern. Do you think that if they put me through this surgical procedure, am I going to feel functional after that? If it's not, I don't want it. So you make the decision. So now you put an attorney in charge of making decisions. So if the attorney thinks that this is not feasible, not right for you, might say, you know what? I don't want to do it. I don't want to do it. Well, here it is. I'm going to make a decision. So everything depends of the decision of the attorney. If the attorney says, no, I want you to do anything possible to save this patient's life, that's how it's going to be done. But if the attorney said, no, if it is this, I don't want you to do it. If it is this, I don't want you to do it. Only do this, but not this. Well, it's their decision, not the patient. The patient authorizes someone to make decision. But in this case, it's an attorney. Remember, when we were talking about DNR, do not resuscitate, who was appointed was the doctor. So the doctor has to make the decision whether to resuscitate or not. But you're not going to resuscitate because you were told not to. So any doctor who sees this document, they're going to see. It's not just the document. The patient carries a bracelet or a necklace where it says they are DNR. We have to read. Whenever the patient comes to us, we have to read. Or they have a little card in their wallet or their purse. It says, do not resuscitate. And we have to honor that. So if the emergency passes by, the police calls, some accident on the streets, and they see the bracelets, we have to read it. Everything we have to read it. So it says, oh, it says do not resuscitate. We cannot do anything. So we're not gonna do resuscitation. We're gonna take you to the hospital. We're gonna stop bleeding, but we're not resuscitating you. And if you have heart stops, not because you're having a heart attack, but if you are bleeding or you were, struck by a car, what are the chances of your heart or bleeding internally? 90%. So you might die from the heart problem, but we're not allowed to do it. We cannot resuscitate you. So here is the attorney, once again, who makes the decision. Here is the same one because it has a different clauses, meaning different wishes. Okay, you can do this, you cannot do this, or so on and so forth. So that's basically what it is. So the patient is going to sign. Remember, the patient has to be in use of all their faculties. So it has to be in a state of mind. This is not at the last minute thing. That doesn't work that way. So that will be power attorney. The Uniform Anatomical Act or GIF Act. Now, probably you have seen it if you have a driver license. Whenever you're going to get a driver license, you can read there and they ask you sometimes, you want to be a organ donor? So if you sign yes, then you will be organ donor. And you cannot change your mind. You cannot say later on, oh, you know what? I'm going to remove myself. I'm going to withdraw from this Uniform Anatomical Gift Act, and I don't want to be a donor anymore. No, I'm sorry. If you sign for the first time, you are organ donor forever. That's it. So once again, as the word implies, you are signing, you are legally accepting that you will be donating part of your body or your entire body. So you have the right to choose what is it that you want to donate? What part of the body do you want to give away after you pass away? So that's basically what it is. So this document sets regulatory framework for the donation of organs. It might be an organ, says, okay, they can take my heart, my kidneys, my lung, blah, 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 whatever it is. Or just a piece of tissue, like skin. Any other parts, bones, the eyes, anything that can be useful for someone. Now you decide to whom or to who you want to make the donation. It's not like, oh, yeah, you can take them. No, you decide who do you want, unless you want to say, oh, well, whatever they needed with my body, I'm not going to use it anymore. So feel free to use anything for any purpose. Well, you still have the choice to decide for which reason you want to donate, to who you really. So it's right here to science. That means to do research about anything, about the medical conditions. For medicine, remember, we can use it again, medical conditions. We're gonna dissect your entire body. We're gonna investigate, we're gonna do biopsies to see what was the cause of the death or any other things. For education, same thing. We can use it for dissection. We use dead bodies that were donated. And we work on real bodies when we were doing dissection, meaning going through the entire body, cutting it off, seeing all the organs, all the tissues, everything that was left within the body. So that's how we learn. So if you determine that's what you want to do, you have to be specific. Otherwise, I can donate this, and that. Well, they're going to use it for any purpose, unless you determine what to do. So remember, your driver license stays right there, and they ask you if you're going to be an organ donor or not. Remember, if you sign yes, it's going to be on your ID, your driver license is going to be there on the back of your driver license. And it says organ donor, and it's going to be checked. Remember, you cannot remove from there. You are an organ donor, that's it, you cannot change your mind. Okay, so this will be this Patient Self-Determination Act documents, legal documents that you can sign. Remember, here you decide, here is just donating after you pass away. This is not deciding what they're gonna do with your health, whether they can fix you, try to fix you or not. No, this is after you have died, then they can use parts of your body or your entire body for any of the purposes written there. You have not chosen any of those, you have not chosen any of this, then, well, they will use it in general for anything that they need the body. Any questions about these advanced directives? Now, these
I do have a
advanced,
question, Professor.
sure, go ahead.
Yeah, so I'm an organ donor, and I wanted to know directly why is it that once you do sign and become an organ donor that you cannot change your mind? Like, why is that? Like, why is it stamped that way?
Well, I cannot give you a clear answer about that. That's the requirements for them. That is their policies. Of course, when you are becoming a volunteer to donate this, they not tell you any of that. They're just gonna tell you, okay, you wanna be an organ donor, and you said, oh yeah, because sometimes you feel like you're in a good mood, right? Or you're gonna be doing good after. But eventually, you know, that's their policies. Yeah, Your living will, you can change your mind if you got into an accident and you are conscious about it, and you can say, you know what, do whatever to save me, forget about the paper. But someone else cannot do it for you. But this is because this is mostly after you die. But yeah, I understand your point. At any given time, you can try to change your mind, right? So let's say that you went through an issue, you were waiting for an organ donor for a family member, you never receive it, or for a family member, you're gonna get pissed off and said, "Oh my God, I'm a volunteer. I'm gonna be giving my organs now. What is it done? My family, my member, my friend needed one, and nobody they didn't give it to them." Well, I cannot think about that because that is, there is a lot of shortage of organs. But in reality, to answer your question, is that's just the way that they have the policies. So unfortunately, they don't tell you beforehand, before signing the document. They just, you just think that, no, it's an easy thing that, well, I can change my mind later on, probably. But this is lack of information. That's why before we sign or do anything, we have to do a little more research, ask questions. But once again, remember, this is after you die. So it's not that they're going to kill you to get the organs, right? So this is after you die that, whatever is needed, it will be used. So that's basically what it is. Anything else?
The only reason why I did ask that was because I do watch a lot of trauma in the ER, and there was like a episode where a family felt like negligence was committed to where that the doctor didn't do the job efficiently enough, and that they were like rushing the whole death process to a patient. So that's why I kind of asked the question. And then it turns out that they still had what do you call it? Brain activity.
Mm-hmm.
And the patient ultimately woke up weeks later. So that's the only reason why I asked that question, because I know there's negligence in every field, and jobs and contracts, and people just do what they feel is needed for maybe the protection of their corporation. But that's really
Sure.
the only reason why I asked that question, because there are some crooks out there that'll do whatever they can to get by.
Yeah, no, I do understand that, and it happens all the time because remember, we have good and bad professionals. So situations like this, remember that I just mentioned something that you probably heard about something or you saw something and you kind of get discouraged. But once again, unfortunately, things happens whether because of these bad professionals, or because of lack of information when you sign in papers, or you are getting into things that you weren't familiar with without not knowing, then later on, if you decide to withdraw from those things, you're not going to be able to do it because that's a lack of information. Definitely it is. But unfortunately, that's how they have it. Can you imagine everybody says, oh, yeah, I'm going to be a donor, but then they're going to say, no, I changed my mind. So it's like they don't want to go through that because once again, there's a shortage of organs. So who wants to donate organs? People are, don't like to do that. Particularly certain religions don't want their body to be touched. Some religions, they don't want their body to be cremated. They want to be buried. Some other they want to be cremated, not buried. So there are different, situations. But to be honest with you, that's the best explanation that I can give you because I haven't even looked through that. But you gave me some homework. I'm gonna try to figure it out, find out why. But as far as I'm concerned, this is how I think the things are. Because that's something that is going to happen after you die, not, you're not giving consent. And if you get sick, they're going to say, we're not going to treat you because we want your organs. So no, this is something a little different. Okay. But good question. Thank you so much for asking.
Thank you so much for your opinion too. Thank you.
Okay, sure. But I will look through it and or into it and add. And if I get something new, I'll let you know. All right. Okay.
Okay, thank you.
Anyone else? Any other questions about anything that we have talked about it? Remember, patient's confidentiality, privacy, very important subjects and because they are very important for us, they like to, they appear, they show up on those tests because they want us to know because they are important. Okay, let's talk about a little more because this is very important, minors. Now, Hello, hello. Hello, hello, hello.
I can hear you.
I don't know what's going on. It's been logging me off, and this time it logged all my students. Okay, so I think that we are connected now, hopefully. See, it was like really weird. Okay, let me see if I was still here. Can you see the PowerPoint presentation?
Yeah,
Yeah.
definition of minors, yes.
Okay. Can you see what it says definition of minors?
No.
That's what I'm trying to do.
Yeah, because
I can see it.
Okay. Who's not seeing the presentation? Try to, refresh your screen because I just put it on.
okay, I'm gonna get out and come back in.
Yeah, please. Because it's been logging on and off, so probably that's the reason why. Okay. So
Okay, I could see it now.
all right, good. Yeah, probably that was the problem. Okay, so let's talk about minors. Remember, when we are in the medical, we categorize our population by age. So it's very important in law and ethics to understand this because sometimes, once again, as I was mentioning before, some of the parents come to our office with a child, someone who's a minor who was in between 13 and 8 and before 18 and 17, and we're going to do some physical exam on the patient, ask some sensitive questions, and then the parents wants to be there. But before we start asking that, we usually ask the parents to leave the room. I don't know if this have happened to you. This is not discrimination. This is not that the doctor is going to be doing something bad to your child. No, this is HIPAA regulations, privacy. So you got to understand that. It's very important that we follow all these. So that's why we have to ask sometimes. You have to, the doctor is not going to tell you. Remember, it is illegal. The doctor is not going to say, listen, Mr. Mrs. Brown, I'm going to remove you because I'm going to ask your child questions about sexual activity, drugs abuse, or going to ask about venereal diseases, alcohol, drug abuse, something. It's going to be sensitive. So if we are going to ask these questions in front of you, the child is not going to respond. What makes you think that your child is going to tell in front of you, yeah, I mean, using drugs, yeah, I mean, having sex, yeah, I mean, doing this, they're not going to do that. So for that reason, to protect the minors, we need to remove you from the room. So that's basically what it is. So don't get upset. And just understand that this is for the good of your child. Because if your child do not tell me the truth, do not say, yes, I'm doing this and I'm doing that, I'm not going to be able to protect your child. I'm not going to be able to do the exams that the child needs. I'm not going to be able to recommend certain safe methods that they have to use, but not to get, sick with something that they don't want. So that's basically what it is. So minors are very important. Remember, minors, we have mature minors, we have emancipated minors. So we're going to see what is the difference between them. So a mature minor, think about that. Someone who thinks like an adult, if you will. Sometimes we have kids, then you ask something and says, oh, that's very childish. You want to talk about something else? You're talking about little things here and there. They are really, really mature for that age. But it has to be an age from maybe 15 and above. Each state has a certain type of regulations for that. So that's basically what it is. If you see that it's mature, that can make decisions, certain decisions for themselves, that's considered a mature minor. Certain decisions. Now, be careful with this, because when they can make certain decisions, that means that they can give consent to the medical doctor to do certain procedures. Now, again, this is where, we're gonna assume that the patient already is getting into these ages when it's gonna become sexually active, that is gonna be exposed to drugs. So now we're gonna make sure that we're gonna guide this patient, put it in the right track, at least to protect themselves and from the medical point of view. Now, an emancipated minor is totally different. Well, it might be a mature minor, may not be, but it is minor. It's less than 18 years of age. So again, all depends of the state. Each state has an age that they can use as to determine whether you can become an emancipated minor or not. Well, most of the time it starts from age 14. Some of the states, other ones 17, 16. But remember, some people don't want to wait until they are 18. So they can kind of, leave these ties with the family. They want to make their own decisions. But that comes with a price. So to be an emancipated minor, you have to be able to support yourself. You can't be an emancipated minor. Oh, well, I'm going to be an emancipated minor. I don't want to listen to you, mister. No, but you are living under my roof, no, not paying rent, you're not paying anything, and I have to support you, I have to feed you. Then you're not an emancipated minor. So legally, to be an emancipated minor, you have to meet certain criteria. So that's basically what it is. You don't want to live under my rules, then you're going to pay for your bills. Now, some of the criteria for you to be an emancipated minor is first, that you have a job and you support yourself, that you can pay your own rent, that you can feed yourself, you can buy your own food, that you have all the things that you need. So that's an emancipation. It's not that I'm going to become emancipated and I decide myself. No, this got to go through a court. You got to go through the court, and the court is going to decide if you meet the criteria. If you don't, you won't be emancipated. Another criteria is not only that you have a job and you're responsible for yourself. The other one is that you enter the military forces. So let's say that you are 16 or 16 and a half, 17, less than 8, you're not 18 yet. So your parents give you permission to join the military. After you join the military, you are independent. You are an emancipated minor. That's it. That meets the criteria. You have a college degree. You are an emancipated minor. Because with a college degree, you can look for a job. But if you have a job and you can support yourself, you don't have to have a college degree. But the most important thing is that you know that you have the means to support yourself. If you get married, be careful with this. You become married, so you get married. Now you have to have your own place. And you have to have the means to support not only you, but your wife or your husband, if that's the case. You never know. So basically, those are the most important things. Now, an emancipated minor is not the one that gets married and go live in your parents' house, don't pay rent, don't do anything. That's not an emancipated. That's a parasite. So remember, this got to be through the court of law. The court of law, the judge is going to decide if you can be emancipated or not, depends of following any of these criteria. But the most important one is that you have to have the means to support yourself. Other than that, they're not going to declare you a minor, an emancipated minor. So I hope this is clear for you, because some people says, oh, yeah, I don't want to be living in the under my parents' roof because, oh my God, I have to meet the curfew. I'm not going to be able to go whenever I go. Yeah, well, you're going to do that, but you have to have the means to support yourself. Because now you're not going to be receiving from your parents, and your parents completely detached from you on that aspect. Oh, you want to claim that you are an emancipated minor? Well, so then you do it, but I'm not going to give you my support. And the law is going to protect the parents because you already decide to become emancipated and you meet the criteria. Sorry about that. So you don't want to follow my rules, then, you go somewhere else and you do it. So that's basically what it is. Let's talk about patient responsibilities. Any questions about mature minors, or emancipated minors, whatever the case may be? Remember, this is important because we need to understand a little bit, not because we're going to come in contact with these patients, but in our own families. We hear so many things and sometimes we don't even know what it is. Yeah, I want to emancipate. Yeah, go ahead. And they leave your house for 3 days, 5 days, and then they come back. They are not emancipated. They just run away for a couple of days or for a month or so. And then they back to you because they couldn't support themselves. So that's basically what it is. So patient responsibility. Remember, the patient has rights, but also have responsibilities. The medical has rights, but also have responsibilities. So what are the major responsibilities of the patient? To follow the physician's instructions. This is one of the most important ones. You have to follow what my recommendations are. Take this medication at this time, follow up with the appointments, do this, do that. That's basically simple thing. If you don't follow that, then probably you're going to get me in trouble for not following the instructions that I gave you. So now I'm going to be thinking about whether withdraw from the services. What will be those instructions? Make or follow up appointments. So you have to make appointments when you feel like you need it. You have to come to your doctor. We have to do the checkups. How do you know what's going on with you? We don't. If you don't tell us, if you don't visit us. So you have to follow the instructions about treatment. Remember, treatment means medications, exams, laboratory exams, imaging reports, seeing a referring physician, and so on and so forth. So that's very important. And that's one of the reasons why sometimes we have this lawsuit. Because patient do not follow the instructions, then they blame the medical doctor. But remember, in order for you to sue the clinic, you can sue anyone. But in order for that lawsuit to go through, you have to meet certain criteria. This is like we were talking about the emancipated minor. You have to meet certain criteria in order for you to become emancipated. Otherwise, you won't be emancipated. So still you're under the rules and regulations of your household or your parents, so to speak. Be honest. Remember, you have to tell us what's going on. Oh, yeah, I'm taking the medications. Oh, yeah. And you're not taking it. Oh, this person likes to drink over the weekends. So because you cannot drink and take medications at the same time, you stop taking the medications. Now you get sick and then you're going to blame me. Well, we're going to do some investigation, remember. So that's basically what it is. So sooner or later, remember those lawsuits, they are not settled in a couple of days. No, sometimes it takes months, years, because they're doing all the investigation. What's going on? Who's to blame? The patient is responsible to pay for the services. Remember, if I have a contract with you, you accept my services. So you're going to pay me for it. So you don't pay my services, I have the right to dismiss you. I have the right to withdraw services. So I'm withdrawing services not only because you're not following the instructions. No, I'm not. I'm doing it because you're not paying for the services. What happens if you don't pay the rent? They kick you out. If you don't pay your bills, your phone bill, what are you going to do? Oh, well, they're going to cut your services. So basically, it's the same. I'm providing some services, so you have to compensate me for that. It is the patient's responsibility to provide informed consent if the patient decides to go through the procedure. It is the responsibility to say yes or no. It's the patient's responsibility to refuse. It is a right, but it's your responsibility because if something happens to you, you're responsible for the consequences. So sometimes the patient thinks, oh, yeah, I can refuse this. So they think that they're getting away with stuff. No, this is for your own benefit. This was about you. It's not about the doctor. This procedure is for you. This medication is for you. You don't want it. You are the one who had the problem. I'm the one who's trying to fix it, but you're not allowing me because I cannot have those results. I cannot have those evaluations. We cannot move forward. Therefore, I have to withdraw your services. See, all this is important. And we need to understand it that way. Any questions about patient responsibility? So we talk about consent. Oh, let me check something else before. Okay, so consent. Once again, very different. We have two terms, consent and informed consent. I discussed that already. So make sure that you do understand this. Consent is just asking you whether you agree or disagree. I'm going to draw your blood. Sure, not a problem. They raise their arm. They just sit on the chair where you are pointing to, when we're going to be drawing the blood. Gonna do an EKG. They don't say anything. I give you the gown, you take it, you change yourself, you remove your clothes, you do the thing. You are accepting that. So it says right there, consent is a voluntary agreement by patient to allow medically trained personnel to touch, examine, and perform a treatment. So basically that's what it is, because we cannot be touching the patient without the patient consent. that will be called bodily. So touching the patient without the patient's consent is called bodily. It's not malpractice. It's not any of those things. It is called bodily. It's not assault. We talk about this. Remember, assault means that you threaten me. If you don't allow me to do the blood, to draw your blood, then Mr. or Mrs. Brown, you're not gonna be allowed to come here to our clinic. You threaten me. You threaten me to drop my services because I'm not allowing you to draw my blood. No, I have the right to refuse. So those are the things that you need to understand. So that is simple. So remember, you should not threaten the patients, coerce the patients to do something. Oh, if you don't follow this, well, the doctor is not gonna see you again because you're missing your appointments. Yes, that's gonna be a result, the consequences of you not complying with, the policies of the organization. But that's not your job to tell the patient. The patient is not gonna tell you. I will never. The doctor is not gonna tell you that. The patient. I will never tell my patient, listen, if you're not coming here, I don't want to see you anymore. That's not how it works. I have to be very professional because he can sue me for abandonment, for assault. You're assaulting me. You're threatening me that you're going to finish my services because I don't want to do this. I have the right to refuse. So they have grounds to sue you. And you don't want to go through that. Oh, definitely not. So even though if you think that the best way is to withdraw the services, you're going to do it in a very professional manner. Mr. and Mrs. Brown, I see that you're missing according to my records, I see here that you are missing follow-up appointments. You're canceling all the time. You're not taking the medications. I gave you this order to go do this procedure. You never did it. I'm very concerned about your health. So for that reason, I have decided to withdraw the services. You have not paid me. So all those things, because you have obligations, you have responsibilities, and there are consequences because if something happens to you, that's going to fall on me. So I don't want to be responsible for all, these problems that can be avoided. You're not following my instructions. There is no way that we can work together, period. So I'm going to dismiss you, but I'm going to give you those 30 days once again. There are two types of consent: informed, which is express consent, and implied consent. So remember those two because they're going to come in your exams and you're going to be seeing them all the time in practice, in real life. You're going to ask them to sign a document to do a procedure. That is an implied consent. But that's not going to be you. That's going to be the medical doctor because the medical doctor is the one that is deciding which test, which treatment, which procedure the patient needs. And the medical doctor knows what are the risks, what are the benefits of doing or not doing the procedure. What other options do we have? Do we have to do a surgical procedure? Can we do medications? Can we do some type of therapy? So we're going to discuss all that with the patient, and the patient is going to make a decision. It's going to decide which one is going to go. But we're going to use either or. Remember, informed consent, it is most of the time, it's not most of the time, it is all the time written. The patient has to sign the document. Because I'm informing you, I'm giving you all the details about the procedure, about treatment, benefits, risks, options. You can decide if you want it or not because you have all the right to refuse. But remember, if the patient refuses to sign the informed consent or refuse the implied consent, if there are consequences, particularly an implied consent, you don't need to sign a waiver. Oh, I don't want you to draw my blood today. The patient is going to die because of that? No, I'm just going to write down on the medical records that the patient didn't allow me to draw their blood. They refused to do it. But if I'm going to do a procedure, and because of this procedure is kind of life or death situation, then the things are serious. So you can get me in trouble. You can sue me for negligence. You didn't do what you're supposed to do. You didn't order anything. So I'm going to order it, but you didn't want it. Now I'm going to ask you to sign a document, a waiver, with you remove all the responsibilities from me and from my practice. That is it. That's inform. Remember, inform is a serious thing that you're going to do. That's what you tell the patient, the ins and outs, the benefits, the risks, and other options. Other options means, yeah, other treatments, other things that probably this is too risky. So I want something that is not too risky. So still, we're going to tell them the benefits and the risk of either procedure, either treatment. Implied consent, remember, is written next. But just keep in mind that it's not kind of very serious thing that we're going to do, very serious procedure. It's not a life or death situation. So if the patient refuses, still, we're not going to ask them to sign a waiver, but we're going to document it that the patient refused. Remember, this is more likely done by the actions of the patient. So let's talk about inform. I already explained it to you. So inform or express consent. Express that now means that it's fast. Expressive means this is not express, this is express, which means that it is very specific. I have a lot of details that I have to discuss with you before you agree or disagree with this particular procedure or treatment. Remember, you have to tell consequences, meaning the risks of having or not having this particular procedure or treatment. Not only the risk, I have to give you options. Well, you don't want to do that surgical procedure. Well, we can start with some medications. What about radiation therapy? What about chemotherapy? What about combination of both versus doing an open or laparoscopic surgical procedure that, according to you, maybe it's going to have more risks. But I have to tell you what are the advantage of doing this and disadvantage and the advantage or risks and benefits of doing this other procedure. But I have to give you options. Now the patient has to sign once again, and we have to have a witness. The physician signs. We have a witness and we have the patient sign. So this is not like, oh, I'm going to force the patient to sign. No, it's going to be a third person there that is going to be signing as a witness. And if something happens, this witness is going to be in the court of law, testifying what really happened, how this consent was done. Remember, consents are done by the medical doctor and the patient, not by the medical assistant, not by the nurse. You're not responsible for that. It is the medical doctor, because the medical doctor knows exactly what procedure is being ordered and what are the risks and the benefits and what are the options if they do it or not. So that's basically what's important. Here is the consent. Remember, it has to be signed by the patient. Okay, so I explained this already. So just going over this. Oh, what did I do? Oh my goodness. So we are a little off time. So let's take a break. I know we have a little inconvenience, but let's take a break. It's 7:16. So we are going to come back 7:50. Okay? Agree? Disagree?
Yeah,
Yeah, I agree.
yeah.
Okay,
And just a
so
reminder, Professor, not to forget to send the email, please.
okay. Did you send it to me?
Yes. Yeah, I sent it to you before.
Oh, okay.
Yeah,
Okay,
yeah.
sure. I will look into it, okay? No problem.
Okay.
Okay. Get some rest. We come back 7:50, remember, and then we continue with the chapter. Thank you, guys. Okay, we're back. I hope you guys enjoy your break. We have not much to cover, so as soon as we finish with this chapter, that's it, we gotta go. Okay, so, Joanne, are you already in? Joanne? Okay, probably not yet connected. All right, so can you guys hear me?
Yes.
Okay.
Yes,
Yes.
yeah.
Okay, Joanne, you're the one who were talking about the Uniform Anatomical and Gift Act, the organ donor. Who was talking about that? I think that was Joanne. No?
That was not me, maybe someone else.
Okay. All right, so just want to make a little correction. Things have changed. So actually now you can remove yourself from the driver license as a donor, but there are another document that you need to be removed from. So in order for you to do that, you had to go to the motor vehicle departments and change your driver license. And when you fill the application, you're gonna state that you withdraw the organ donor. That is one of the first steps. Then you have to call or email the registry of the Uniform Anatomical Gift Act. You have to contact them directly and ask them to remove you from there. So I just went online and I tried to look for the things have changed. So you can remove yourself from there if you don't want to be a donor, but you have to do these two steps. First, change your driver license. It's not just telling them to remove it and that's it. No. Or changing your driver license is not going to affect anything. Then the next step is calling the registry where they have your information that is used nationwide. And then you can do that. Because remember, if it is nationwide, everybody is going to be using the organs if it is needed. So that's basically what it is. But you can now decide, withdraw from that. So that's something that I want to clarify. Okay, so let's see here. Exceptions of consent. So we're talking about implied consent. Very important. Informed consent is going to be on your exam. Implied consent is going to be on your exam. So for that reason, you need to understand it. Remember, they're going to say, they're not going to ask you, what is informed consent? What is implied consent? They not ask these type of questions like that. They're going to give you a scenario. So they're going to tell you, okay, the patient comes to your office, they're going to get blood drawn. So the patient just raises his hand or her hand when you tell them that you're going to draw blood. What type of consent is that? Then you know that is implied. The patient needs to be told about the risks, the benefits, and what other options are there for a procedure, a treatment. What type of consent is that? That is informed because it's informing you of all the things that are going to happen during the procedure. Informing the patient, that's what is informed consent. Remember, imply is the actions of the patient. You tell the patient something, the patient do not talk. They just do things. They not accepting or not. They just raise their arm. They just sit on the chair when you're going to tell them to sit. So they do not say anything. Their actions are the ones that make us think that it is implied. Remember, and this happens only for minor things, for things that are not putting the patient at risk. That's implied. You should not do implied consent to do a surgical procedure. except in emergency situations. Exceptions to consent, right here. Now, again, need not inform of commonly known risk. So you don't need to inform a patient that it has a serious condition, like an emergency room. You don't have time to be discussing risk and benefits. You don't have time. The life of the patient is at risk. So for that reason, we do not do informed consent. Instead, we do implied consent. We assume that the patient needs this treatment. Otherwise, the patient would die. So we do it. So remember, in emergency situations, we don't use informed consent. We use imply. So question for your exam. You are at the emergency room. As soon as you see that is the emergency room, think about all these exceptions. You do not work the same way as someone who's not in an emergency. So immediately they're going to tell you, okay, the patient is unconscious. What type of, he's in the emergency, is unconscious. What is the type of consent that we're going to use? Inform. The patient is unconscious, cannot talk, cannot disclose any information. How are you going to consent the patient? How are you going to explain the patient the risk and the benefits and the options for this particular treatment? There isn't chance for that. So again, you need to know where deception applies. Emergency room is the place where most of deceptions are used because it's an emergency. But remember, do not understand emergency as a general statement. Oh, I'm being in the emergency and they ask me all these questions. Well, you are in the emergency room, but you do not have an emergency. That's not what we're talking about. Remember, I mentioned that emergency room and you stating that have an emergency are two different things. Someone who really have an emergency do not say I have an emergency because they are, remember, emergency, the definition of emergency is life and death situation. Their life, the patient is at stake. So it's not someone who comes walking and doing all these things and, hey, I'm feeling good. I just want to be seen by the doctor. No, this is not the doctor's office. This is not an outpatient. This is emergency. That's what they put you to wait. They are long hours because your situation is not an emergency. We're going to be seeing you. But first, we're going to take care of the people who are at the risk of losing their lives first. Whoever has a serious condition. So think about that. So don't put your experiences or the things that you have seen when you're taking a test, because that is when you're making the mistake. See, if I'm taking a test and I'm thinking about, oh yeah, I'm being to the emergency, I forgot my medication, so I took my friend that has the cough or has a little, loose stools and oh, it's dying. No, that's not dying. Yeah, you went to the emergency and they ask you this bunch of things. What are you here for? What is the reason? Oh, I have a stomach ache. Oh, I have the, well, that's not a real emergency. So don't confuse those things because when they say emergency means that the patient definitely cannot make any statements. So for that reason, we assume that the patient needs our help. So we take that consent as implied. So that's basically what it is. See, sometimes we just base our answers not on the lectures, but on the situation that happens to us or we have seen. Don't go by that because then you're going to choose the wrong answer. It's not what you think it is or what you saw in certain situations. No, what is the reality? So that's what we have to kind of pay attention when we're taking a test. And remember, when your national certification is not going to have all of the above, none of the above, they're not going to give you that answer as a choice. It's going to be A, B, C, or D. Only one single answer. So for my test, when I give you all of the above, remember, one of the key to taking an exam is if you see all of the above, that is the right answer 99%. At any test, in anything that you take in. It's just that the national certification don't give you that option anymore. None of the above. When you see none of the above, that is not the right answer. It's the opposite of all of the above. So all of the above is 99.9% the right answer. None of the above is the 100% the wrong answer. Remember, the streams are not good. But when we talk about streams, we're talking about always, never, only exceptions to the rule apply. And that's what we mention all the time, deceptions. Because when deceptions are there, we like to ask about deceptions. Because these are something that rarely happens. And when they happen, we need to know about it. So that's basically how this works. I'm telling you, follow my instructions, all these keynotes that I'm giving you. And I'm telling you, you're going to do just well because most of the things are common sense. Patient comes to your office and is screaming at you. So what should not be your response? Well, you should not tell the patient to calm down. Most definitely. How can you tell the patient to calm down? They are already upset. If somebody tell you to calm down, remember empathy. Think about what would you do? What would be your reaction if somebody to ask you to calm down? No, I'm not gonna calm down. I need some help. You're asking me to shut up. So I'm being offended. So you think that, when you're talking to your friends, they said, oh, just shut up. Well, you're not gonna just shut up to the patient. He says, oh, just calm down, relax. Oh, no, that is a no. Remember, professionalism, empathy. So think about not the things that you will do with your friends at home. No, it's the real thing in the real perfect world. What would you do? Says right there, exceptions to consent. Well, this is not exception. This is telling the truth. You should not tell the patient that you are going to go back to the original state of health, how you were before. Oh, I'm going to restore you to the original time when you were feeling perfect. And here, what it's trying to explain, there is an exception to the consent. I'm not promising you, I'm not guaranteeing you that everything is going to be fine. And remember what I said before, you shouldn't be telling the patient, no worries, everything is going to be fine. We're going to help you. Yeah, we're going to try to assist you, but I'm not going to promise you anything. So there is no guarantee during this procedure, everything is going to be fine. No, you are consenting to the risk and the benefits. In the unforeseen situations, we mentioned things that are very common that happens during these particular procedures because we have precedents from other cases. So we base on that, we tell you what the possible risk and benefits and what other options you may have. But we are not required to restore you because that is not something that, well, depends on us sometimes. So we're never going to tell someone, oh, no, we're going to put you back like 20 years younger. And ain't happening. See, cannot elicit cure for every patient. You cannot tell the patient that, we have a cure for you. Oh, no worries. You're going to be fixed. Again, comes to the same thing, we're going to put you back to normal, the way that you used to be. No, probably going to repair something, but you will never get back to wherever you were not sick before you became sick. Oh, you're going to be feeling like nothing happened, that you were never experiencing this. No, that's not true. And that's exceptions to the consent. Just because I'm consenting you does not imply that nothing bad is going to happen. No, there are some risks, but there's going to be some unforeseen risk, something that I don't know that's going to happen. Because I don't know how your body is going to react to certain procedures. Under the anesthesia, anything can happen. That comes to the conclusion of saying cannot guarantee successful results of every treatment. You can't. It's just impossible. But remember, some of the professionals, they kind of reassure the patient. They're not going to say, I guarantee that I'm going to save your life. I guarantee that I'm going to fix your problem. No, you cannot guarantee. That's false. For that reason, it's an exception to the consent. Because you cannot, sue us after the procedure because something went wrong. Because that's what you were informed about the risks and the benefits. Oh, but you didn't mention this. Well, that was an unforeseen condition. We did that the best that we can. It's not our fault. Well, that needs to be investigated anyways. But there are things that happens not because the medical providers did something wrong, but sometimes it does. So the consent is not just to excuse the medical doctor for wrongdoings, for malpractice. That's not what we're talking about here. It is done, it protects both the patient for malpractice and the medical doctor from being sued. But all depends on what we say, what we do, and how the patient understands things. Because one thing is the way that the patient understands things. Another thing is how we tell them the things. So we got to make sure that when we explain them, they actually understand. And that's what we gave them options. Okay, if you don't want to go to the procedure, you don't have to wait that the patient is going to ask you. Okay, you're going to have an open heart surgery. That's it. There's nothing else. That's the only thing that can save you. But actually, there are other things that we can do, like catheterizations, placing a stem, replacing the bulb. We don't need to remove the heart. We don't need to replace it. So we're lying. So that's not good. So we have to tell them that there are other options, not necessarily, but this will be the best one because all those problems inside the heart, they can fail later on. The treatment that this can be fixed, but then it can fail again. But if we change the whole thing, but there is the big risk that you can die during the procedure. So what do you want? So we give the options to the patient. And if the patient signs, now, if something happens to the patient, well, there was a risk there that you might die during the procedure, and you were aware of because we told you. Now, if we don't tell you that dying during the procedure is one of the risks, then we are going to be sued for misinforming the patient. So that's basically what it is. So everything, most of the things that, dying, it doesn't matter from what he died or she died, but if it's something happening, it was within the consent. Because there is a risk that can happen. So omitting that information can cause problems. But mentioning it doesn't happen is good. Mentioning it happens is also good for the medical providers. That's why we have to document everything and explain the patient the cons and the pros before we do something. And if the patient agrees, fine. If it doesn't agree, it's also fine. We just need to ask the patient to sign a refusal of treatment, a waiver. So it doesn't, the patient doesn't, it's not, blaming us for whatever reason. Oh, well, they didn't want the procedure, but you know what? They should insist. So that was their fault. They didn't do enough. No, the patient had the right to refuse, and they sign a waiver, refusal of treatment. So the doctor, the clinic, the hospital is safe. So if you refuse, we cannot do the procedure. Period. So that's what it's telling you right here. Any questions about deceptions or about anything else? See? Refusal to grant consent. So again, who can refuse? So someone who is in good state of mind, someone who is competent. Remember, when you see questions on your exam that this patient is not competent, that means they cannot make decisions for themselves. Someone has to do the decisions for them, like a minor, a child, someone who is mentally disabled. You should not use these words when you are at work, when you're handling conversations, or when you are interacting with someone. Oh, you are mentally retarded. That is not a good statement. That's a very demeaning statement. That's said mentally disabled, mentally incapacitated. So that's basically what we're going to do. So when someone is in that part, in that situation, someone else has to make the decisions for them. But if it is an adult that is conscious, in good state, mentally capable to make the right decision for themselves, I know this is convenient after all these benefits, risks that I was giving during the informed consent. I'm gonna make sure that I kind of put myself, and make the best decision for me, for the treatment that I'm gonna receive. So it is up to you. Says right there, refusal must be honored no matter what patient's reasoning. See, it doesn't matter what the patient, what the doctor thinks, but what the patient is thinking about the procedure. If they say, I don't want it for any reason, it doesn't matter the reason. We as medical providers, we're gonna try not to coerce you, not to force you to do things that you don't want to do, but to make you realize that it is very important to do this procedure due to the risks that the procedure, the condition that they have versus the risks. Remember, the patient's always going to think about the worst. When it comes to surgical procedure, there is a risk. There is always going to be a risk that you might die during the procedure. There are some procedures that are very mild procedures, so to speak. They don't have many risks, like doing a laser to the lenses of the eyes. Sonolaparoscopic procedure, like removing the appendix. This is something done as long as the appendix has not burst open and contaminated all the organs inside the stomach. Well, chances are that nothing's going to happen. You're just going to remove the appendix and that's it. So there is not many risks there. We don't have many risks with the patient. But if the patient sees the risk, because we have to tell them, one of the risks is that you might die during the procedure, and it has to be written there, and it have to tell you, because there have been cases in the past in the same procedure. The patient have died during the procedure, so we have a precedent, we have a history of that. We need to let the patient know, and that's one of the reasons why the patients decide not to do the procedure, to opt out from the procedure. So that's basically what it is. But we have to tell them everything because we don't want this misinformation, to bite us back, to fire back, because we're going to get sued. So again, it doesn't matter what is the reason that the patient is refusing. We are going to try to reason with them. Family members are going to be invited, and so the patient can make the right decision, because this is not something that is going to be done like immediately. Well, it's needed. If you want to think about it, don't take too much time, because time is very important. This is not an emergency. An emergency situation, remember, we don't need an informed consent. We are saving the patient's life. But if the patient is talking, the patient is conscious, the patient is in good state of mind, he or she will decide whether they want to do it or not. So then we inform them because they are in good state of mind. So that's a different issue. Now, what happens if we do not honor what the patient wants, the refusal? We are going to get in trouble. Remember, I'm going to be touching the patient during the surgical procedure, cutting something, moving something, or removing something. That's called assault and battery, because first, assault because the patient didn't want to do it. I did it anyways. And because physically I touched the patient with the instruments, I cut stuff inside the patient's body. Well, that is battery because you're touching the patient without the patient permission, the patient consent. Remember, if you do not follow the policies, I'm saying no, where you have to do things. Think about this. Someone say, no, no, no. Well, if they get sexually violated, that's rape. Because you say no. So the same happens right here. So you're going to be accused. So now remember, assault means a threat. You're not physically in contact with me. You're just talking to me. I'm telling the patient, listen, you better do this. This is the only choice. You have no other choice. We're going to do the surgery, like whether you like it or not. That is an assault. Remember, somebody threatens you on the streets. They call your names and they said, you know what? I'm going to beat you up. I'm going to kill you. They're not killing you. They're just saying words. This may happen. And if it happens, physically you get assaulted, then it's called battery. So remember, battery, if you touch someone without their permission. So you're going to have a question stated like this. You have the patient in your laboratory and you're going to do procedure. The patient refuses. Instead, you go and do it. It doesn't matter. Just go and did the procedure. What are you being accused of? Battery, because you touched the patient without the patient's permission, consent. That is the way that you're going to get the questions. They're not going to say, what is assault? What is battery? What is the consent? What is implied consent? No, it's not like that. They're going to give you little case scenarios. Very short paragraphs. You're a medical assistant, you're working in the emergency. What type of consent you're going to use with this patient? Remember, think about emergency, the definition of emergency, not what you think about emergency. Because you're going to see all these right answers. All of them are going to be right for you. but it's not. It's gonna be 1 because it's an emergency, and the real situation emergency is someone, once again, who is in a life or death situation. Period. In this case, and now they tell you you're in the emergency, the patient is unconscious. What type of consent? Well, it's unconscious. They're giving you all the hints. They are giving you the answer. Hey, this person cannot talk, cannot understand. How you're gonna consent then? How you're gonna explain the benefit, risk of the surgical procedure? Is gonna be implied. So these are, the type of questions that you will get on your exam. And sometimes if we, kind of didn't learn this, it's gonna be difficult for us to make sure that we have the right answer, because we're gonna apply the answers by guessing, by applying to our
Oh,
We're here. His computer probably turns off again.
hello. This was not me. So something is going on with the system. It locked me off with no reason. So don't blame me, please. Okay, can you guys hear me?
Yes.
Okay, so I think that we are done. Any questions? We are done with the chapter, of course. Okay, so for all of you, remember, since I started the class, I was announcing that, this coming Monday is a holiday, so we do not have a class. So you're gonna have a long weekend, you see? Enjoy it. Work on that test that I sent you. There are only 50 questions. Do it whenever you have some time, and then, enjoy your long weekend. Hopefully you do not work on Saturdays and Sundays. I do. I'm gonna work on Saturdays, so, but still, I'm gonna have a couple of days off. So that's gonna be good. So that's about it. Any questions before we dismiss the class?
For the test, it would be in our emails, correct?
Correct.
Okay.
Yeah, you just, and it's on the email and send it back to me the same way that we've been working with the other tests. Mhm.
Okay,
Yeah.
thank you.
No problem. Anybody else? No? Okay, so we're not gonna start another chapter because, I don't want to kind of feed you with all this information. So we're gonna leave it right here. And on Tuesday, remember, we have 2 more chapters to cover, and that's it, we're done. So that will be it. So I'm gonna give you the most, specific information that you're gonna need for you, for your job. Anything else, it's just too much information. I want you to retain some information. If I give you too much, then you're not gonna retain much. So I just want you to kind of relax a little bit. Enjoy the weekend. Okay. Once again, if you
Thank
have
you.
any questions, please email me and I will be checking my emails. Thank you, everyone. Thank you, Mercedes. Yeah, bye now. Take care, everyone.
Hey, teacher.
Thank you,
Thank
thank
you.
you,
Bye-bye.
everyone. Jenny. All right. Okay. So see you then on Tuesday, remember. Don't get upset because I let you go early. Hello, hello.
Good night.
Good night. Take care. Remember, no class on Monday. Good night.